Alright, I'm going to be delivering the postpartum instructions that we would give right before discharge of mom and baby. So, for the first thing, we want lots of rest and good hydration and nutrition for the first few weeks postpartum. For the first few days, we'd like you to stay around your bedroom, ideally. And then in the first 5 to 10 days, just around your house, trying to give your body that time to rest, drinking lots of fluids, and getting those good whole foods that we would emphasize throughout the pregnancy as well. For your postpartum bleeding, expect to have something similar to a heavy period. Might notice some clots passing after you've been lying down for a while and then you get back up. If a clot is larger than the palm of your hand, or if you begin to feel faint or dizzy, or if you're filling more than 2 pads or more in an hour, those are signs to call the midwife. Also, postpartum bleeding has a little bit of a different odor than normal period bleeding, but it shouldn't smell foul. If it does smell foul, or you're starting to get some uterine pain, or you're feeling body aches or cold or flu-like symptoms, then we'd like you to call the midwife immediately. We would encourage you to breastfeed on demand. Signs that baby would like to eat are if their hands are going to their mouth, if they're licking their or smacking their lips, if they're bobbing their head around or rooting. Those are all signs to put baby to breast. If there are any clicking noises or the initial latch is feeling uncomfortable, break the seal with your fingers and then relatch. A poor latch is what causes nipple pain or cracking or blistering, and you want to avoid that. Keep a glass of water near you during every feeding, because we want to keep you hydrated as you're feeding the baby. And your milk should be expected to come in around day 3. If you notice any lumps or hot spots or red streaks on your breast, then that would be another sign that you would like to call the midwife. It could potentially be a breast infection. Ways to prevent other infections: practice good hand washing. When you're going to the restroom, or changing your pads or changing the baby's diaper, you always want to keep your hands clean. And then if you begin to feel feverish or are having some cold or flu-like symptoms, check your temperature. We'd like you to contact us if the temperature exceeds 100.4. For your bottom, it may be swollen and sore for the first week or so. You might feel stinging when you're using the restroom, especially if you had a tear or any stitches. Use your peri bottle to clean yourself, and toilet paper to pat dry if you need to, but do not wipe your bottom for the first little bit while you're still feeling that stinging sensation. Also, an herbal sitz bath in a clean tub frequently might help with the healing process on your bottom and soothe some of that pain. For bowels, it might take a couple days for your first bowel movement. A lot of women are nervous about the pain of their first bowel movement, which is extremely common. Generally, the first bowel movement is not painful, so try not to worry about it. Drink lots of fluids, add fiber into your diet, and avoid straining. Try to breathe it down, just like when you're pushing in labor. We want to try and breathe it down rather than strain. For urination, we'd like you to urinate frequently. Postpartum is the time when our body's trying to get rid of a lot of fluids, so you should be feeling the need to urinate frequently, especially with all the water we are encouraging you to drink. An empty bladder also allows for your uterus to turn to normal size. So after urination, we want you to rub your tummy to get that uterus to contract down. For the baby, we talked about on-demand nursing. Milk comes in at day 3, and to make sure you're reading the signs, the early signs that baby is ready to feed. You don't want to wait until they're crying, otherwise they might be too unsettled to be able to eat. Baby's breathing, It might be irregular at first, and that's okay, but it shouldn't sound difficult or labored. Um, Nursing, as well as coughing and sneezing, are ways in which the baby clears that extra fluid out of their bodies. Call the midwife if your baby is having like bluish gray around their mouth, their face, or the trunk of their body. It's pretty normal for the first little bit for the baby's hands and feet to be blue, but if it's around their trunk or their mouth, we'd like to know that right away. For cord care, we want to make sure that the diaper is not over their cord, that it's tucked down. And the best thing you can do for the cord is to keep it dry and clean, and it should fall off generally within 4 to 10 days. If the skin is swollen or red, you could call the midwife, and some people treat their cord with golden seal and a cotton swab if you'd like to do that. We put in your document normal temperatures for the baby. Call the midwife if they are either low or high in their temperature outside of those normal limits that we've given. Diapers, the baby should pass urine and stool within the first 24 hours of life. The meconium, which is the first stool, is really sticky. We usually apply oil to the baby's bottom, which makes it really easy for wiping off that sticky meconium. And then after a few days, once all the meconium is gone, then it turns into a yellowish greenish color. Might be a little seedy looking after the breast milk is taken in. For the first week of life, the amount of dirty and wet diapers usually aligns with however many days old the baby is. And then after a week, you can expect the diapers to be about 6 to 8 times a day. Jaundice is a yellowing of their skin tone or a yellow in the whites of their eyes. This is normal in the first few days of life, like the 2nd day through the 7th day of life. If the baby is showing a jaundice color before they are 24 hours old, the midwife needs to know that immediately. If it's between the 2nd and the 7th day of life, frequent nursing and sun exposure can help get rid of that what's called bilirubin in their skin that's making them yellowy. It's normal for babies to lose weight, about up to 10% of their birth weight in the first few weeks of life. They should return back to their birth weight by week 2. A midwife will be doing weight checks several times postpartum, so we'll make sure that that is accounted for. Some warning signs that you need to call the midwife immediately if these occur. If the baby's temperature is outside of the normal limits for an extended period of time, and you've done like trying to warm them up if they're cold, or undressing them to cool them down, if it persists, we'd like to know that. Labored or difficult breathing, if the baby's nostrils are flaring, if they're grunting, or if their ribs are sticking out when they're inhaling. The bluish gray around their mouth or trunk, the yellowish skin color in the first 24 hours of life, or if the baby is tired or uninterested in eating, if the baby has developed a really high-pitched cry that doesn't sound like their normal cry, if baby has bruising or unusual bleeding, or if they are showing signs of seizures, which might be their body stiffening or their eyes rolling back in their head or fluttering, or if they're just staring and unresponsive to you. For the mother, if some warning signs are a temperature greater than 100.4, breast tenderness, those red streaks, the hot spots, the lumps, or the full body aches or fever, tender or sore nipples, difficulty urinating or passing stool, sharp pains in your either abdomen, your uterus, or your breasts, any signs of swelling or infection, any changes or blurry vision with or without headaches, any pain in the leg, especially in the calf area, change in bleeding, foul smelling bleeding, or passing large clots, consistent feeling of sadness or hopelessness, thoughts of harming yourself or your baby, or any feeling that you just feel that there's something wrong or not right, either with you or a baby, we would like to know immediately. So those are all the things we have written down that I'm going to give you in this handout. And if you have any other questions, feel free to call the midwife as well. Those are all acceptable.